My name is Morgan Snyder, and I decided to do my presentation on SARS/COVID-19, or otherwise known as coronavirus, as my favorite infectious disease to present. I chose this disease because not only is it new, but I wanted to learn more about the virus so I could be more educated on it, and so I could share what I learned with my family and friends who are constantly reading incorrect information online or listening to the social media. So to start off, what is SARS/COVID-19? According to the CDC, COVID is a new disease that is caused by a novel coronavirus, which means new coronavirus, that has not been seen previously before in humans. COVID-19 is an envelope and has spike proteins. According to Professor Emily Tromel, coronaviruses feature RNA-based genomes, unlike most of the life on planet, which feature DNA genomes. RNA genomes in coronaviruses are positive sense, which are similar to the cell's own messenger RNA, and allows these viruses to immediately hijack the protein synthesis machinery of host cells. This feature enables these viruses to quickly and effectively take over host cells and rapidly expand. Knowing that it has an RNA in its genome helps us understand how we test for the presence of coronavirus. Also, in addition, they will look at changes in the sequence in the viral genome, so they're able to track the spread of the virus around the globe. It's easy to learn the biology of the virus and how this is changing then. This helps us potentially come up with different ways that we could help treat this. So some symptoms of coronavirus is coughing, body aches, fever, chills, headache, sore throat, congestion, nausea, fatigue, shortness of breath, difficulty breathing, loss of taste and smell, and diarrhea. These symptoms, it's a long list of symptoms, so lately it's kind of funny when anybody gets sick, they instantly think they have coronavirus. Like, it's just not okay to be sick. Like, you can't be normally sick anymore, which is obviously not the case, but everybody's just so caught up in this that, like, yeah. It's also important to look for emergency warning signs. So if you or somebody that you're around is having trouble breathing, is confused, cannot wake up or like stay awake, has blue lips or a blue face, or persistent pain or pressure in the chest, you should seek emergency medical care as soon as possible and call 911 if possible as well. So here are the current numbers in the United States as of December 6, 2020. That was Sunday, so I'm sure these numbers have changed since then, especially with the recent spikes in cases. So as of Sunday, there are over 14 million cases reported since January 1st of this year, 2020. There are an average of 1,319,530 daily cases and a total of 280,185 deaths in the United States. Coronavirus has not only affected history already, but also our culture. The lockdown started in March and continues. People's lives are changed by being forced to stay home and work from home, and even do school from home now. There are no more in-person concerts or games, except for the few that watched football in person this year before in-person ended this week, I believe, but I also do know those tickets were extremely expensive. But life as we know it is completely changed. No one can enter a store without wearing a mask and maintaining 6 feet from others. No one shakes hands anymore, hugs, or even goes out on dates. Businesses that have been around for over 20 years had to shut their doors down this year and say goodbye. As we continue to move forward with the virus, people are getting sick of the quarantine and starting not to care. Cases are rising and families keep gathering for the holidays. It's scary to say the least. Quarantine can help prevent the spread of any disease, especially COVID-19. But quarantine is staying home, being isolated for others for about 14 days. Americans are getting sick of this now. We are going into the end of the year with still no vaccine, or just like not seeing the end of the days with this. During this time, though, people need to watch their fever if they are in quarantine or isolated. They need to watch their cough, and if they have a shortness of breath. Like previously stated before in the last slide, or 2 slides ago, if these symptoms get worse, call 911. Also, close contact is being in contact with someone for over 15 minutes, 6 feet apart, sharing drinks or food, hugging, shaking hands, etc. Any human contact, obviously. It's important to watch for symptoms during this pandemic and self-isolate if you are feeling sick. A lot of people are used to showing up to work still sick, but it's just super important right now to stay home if you are, because we can stop the spread in case you do become positive. Everyone should wear a mask and wash their hands and avoid large crowds to stop the spread of the virus. Reinfection is rare, but cases are being reported, which is to be expected, especially with how long the virus has been out by now. It's bound to people are going to get reinfected. It's just bound to happen. So when it comes to the vaccine, which we're coming up closely to getting, the CDC put out 8 things that they wanted people to know about the vaccine, and I felt like this was important because there's just so much out about the vaccine right now, and not many people know who to listen to. I'm just listening to the CDC, so I will read these off. First, they want you to know the safety of the COVID-19 vaccine is top priority. Second, many vaccines are being developed and tested, but some might be ready before others. The CDC is planning for many possibilities. At least at first, COVID-19 vaccines might be used under emergency use authorization from the U.S. Food and Drug Administration. 4, there will be a limited supply of COVID-19 vaccines in December 2020, but supply will continually increase in the weeks and months that follow. Because of limited supply, some groups will be recommended to get a COVID-19 vaccine first. Those groups obviously would be like doctors, nurses, people that are more susceptible to getting this, people that are around it all the time, just for example. So continued, number 6 is, at first, COVID-19 vaccines may not be recommended for children. 7, costs will not be an obstacle to getting vaccinated against COVID-19. And 8, COVID-19 vaccine planning is being updated as new information becomes available, which everyone should stay on top of and pay attention to. I know this is going to bring out a huge anti-vax movement as we continue to go down this road to getting a COVID-19 vaccine out. So I am actually very curious to see how this plays out in the up and coming year in 2021. I did also want to say that I did speak to a medical examiner over the weekend, and it was kind of scary. He does believe that here in about 2 weeks we are going to see the fallout from Thanksgiving, and we are going to see the highest cases here in about 2 weeks. So stay home, stay safe, just you got to do what you got to do right now. It's a pandemic, and I know it sucks, but you just have to right now. So I actually wanted to mention the funeral guidelines because I am a funeral service major. So I wanted to explain the risks of funerals because I know there was some confusion over the year. It is based on state by state. I did research and see, I think right now Pennsylvania's guidelines are we can have up to 250 people outside, but I think those are changing right now because of the rising cases. But just so everybody knows, with the increase in deaths, I hate to say this, but people might be attending a funeral, and that's just the facts that comes with this virus when people are dying. So the lowest risk for funeral guidelines would be virtual only services and gatherings are held. A lower risk would be small outdoor services held, people are 6 feet apart, people are wearing their masks, no one traveled from outside the area or state, and nothing is being passed around. Higher risk, medium type service is held indoors or outdoors, people try to stay 6 feet apart, some people are wearing masks, things being passed around are limited, some people travel from out of the area for this service. The highest risk is large service held indoors or outdoors. No one is 6 feet apart. Not many people are wearing masks. Things are being passed around. People travel from out of the state. So, unfortunately, a lot of people are dying, not obviously in general, but also from COVID-19. COVID-19 can be spread to the funeral director or loved ones after death. I do know funeral directors and embalmers treat everybody like it has an infectious disease, so we take universal precautions with everybody, and PPE is always worn, and that will never change. But like I stated before, guidelines are based off of state by state, though. I also wanted to add in, if I know this has been a very overwhelming year for everyone with this pandemic, so I wanted to put in, if anybody's feeling depressed, sad, suicidal, please call one of these numbers to help you. We are all suffering on the inside from this pandemic. You are not alone. So the CDC had some recommendations. Call 911, visit the disaster distress helpline, visit the National Domestic Violence Helpline, or contact the National Suicide Prevention Lifeline. And those are there in case anyone needs it or knows anyone that needs it. And then to end this, I wanted to throw in some facts. So the first case was reported in January in the United States. The entry, which I read about in Johns Hopkins a couple months ago, is most likely the olfactory glands in the nose. That's why it's important to have your mask over your nose. It might also be another reason why people lose their taste and smell, because it is entering through the olfactory glands. So make sure your mask is over your nose. People can be asymptomatic and spread the virus just like Typhoid Mary did. I know we're hearing a bunch of people never had symptoms, or some people did have symptoms. So right there and then, people can be asymptomatic. So make sure you take precautions and have your mask and stay 6 feet apart. Also, you might already been infected and not know it. So that cold you had last year could have been COVID. Also, SARS-CoV-2 binds 10 to 20 times more to human cells than the other SARS-CoV. So I just thought these were some interesting quick facts to throw in about COVID, and that is the end of my presentation. I hope everyone enjoyed it and learned something from this. As more and more information comes out, this will just be more interesting, and I'm excited to see where this goes, honestly, over the next year. Everyone stay safe, and thank you for watching my presentation. Here are my references.